my name is Aaliyah Parker. This is my neurological assessment, and this is my patient today. Will you please state your name and date of birth?
Tony Parker, 21272.
And I would have come in and provided privacy for my patient before I assessed him, and I'd ask, do I have your permission to assess you today?
You do.
Okay. Can you tell me what day it is today, the date and year?
November 24th, 2024.
Good. And also, can you tell me what you would do before you cross a road?
Look both ways.
Good. By doing this, I'm assessing his cognition and his judgment and his overall affect. I'm also judging the appearance that he came in, seeing if he's been keeping up with himself. And from here, I would choose whether or not a mini mental exam would be necessary. I do not feel that it is, so we can move on to cranial nerves. We would start with cranial nerve 1, which would be testing his smell in each nostril with familiar sense, but per Dr. Lashley, we can forgo that one and move to cranial nerve 2. For cranial nerve 2, we're going to be assessing his eyes in all 6 fields. And for this, I'm going to, his visual acuity. And for this, I'm going to ask the patient to look at my nose. And then as I hold my fingers up, tell me how many fingers you see, but don't look away from my nose.
2, 3, 3, 2, 2, 1.
Good. And then I'm going to grab my pen light, and I'm going to tell my patient that we are actually now going to do kind of the opposite, where I'm going to have him follow my pen light, and I'll do it in all six fields, and not take his eyes off my pen light. Good. Then I'm going to ask him to look at my nose and keep his eyes open wide. And I'll be checking for reflexes, and he has them. And then I'm going to ask you to look at the tip of my pen light and don't stop looking at it as it moves closer to your face. Good. And that was for cranial nerves 3, 4, and 6. We can move on to 5, and for that I need to get my Q-tip, and I'm going to ask my patient to shut his eyes, and I'm going to ask him to tell me what kind of sensation he feels.
Sharp, sharp, soft, sharp, soft, sharp.
And we'll be checking bilaterally on his cheeks, his jaw, and his forehead. Now I'll move on to cranial nerve number 7, and for this, I am going to ask you to lift your eyebrows as high as you can. Good. I'm checking for symmetry. You can relax. And then give me a big smile with teeth. And I'll be checking for symmetry. You can relax. We would have also done a tasting with sweet and salty things to make sure that was intact. But again, Dr. Lashley said we could forego that portion. For cranial nerve 8, I'm going to go ahead and ask him, have you been feeling any kind of anxiety, vertigo, like your equilibrium is messed up?
No.
Good. Then I'll perform a hearing test. Go ahead and put your hand over your left ear, and I'll stand about 12 inches behind him and ask him to repeat the word I'm saying.
99. 99.
Good. Now will you please do that with your other hand over the other ear. Repeat what I'm saying. 99.
99.
Very good. So we'll move to cranial nerve 9 and 10. And for this, I'm going to ask you to open your mouth and lift your tongue. And I'm looking for the rise of the palatal patch, which is intact. And then I'm going to ask you to say ah.
Ah.
Over and over.
Ah, ah, ah.
Good.
Ah,
you can relax. And then I'm going to have him sip of water, making sure that he can maintain his own airway and secretions, which he does great. And then I'm going to check his sternocleidomastoid and his trapezius muscle. By doing this, I'm going to ask you to turn your head to the left, and I'll assess that. Turn your head to the right, making sure that there's symmetry and no deformities, and then you can turn your head midline. I want you to try and push my hand with your head to the right. Good. Now try and push the other side. Good. And then try and push your head forward. Very good. From here, we will go to cranial nerve 12. And for this, I'll ask you to stick out your tongue. And I'm checking to see that it's midline. Then you can put your tongue in your mouth, and I want you to open your mouth, but push against your cheeks, both sides. And I'm checking symmetry and strength. And then for this, I want you to say la, 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 la.
La, 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 la.
Great. From here, we can move on to his reflexes, and I'll get my hammer. I am going to be checking his brachioradialis, his brachial and his tricep on his upper extremities bilaterally. So I'll have you relax, and I'm going to just have you keep relaxing. Good. And then I'm going to be feeling for his brachial pulse and go right next to it. Feeling or looking for reflex. And then I'm going to have you dangle your arm. Just relax it like you're resting against a wall. Great. And then I'm going to do the other side. Good. Great. Same thing. Just relax. Good. I saw that touching hands. Then I'm going to move to his lower extremities. I'm going to have you kind of dangle your feet. I'll lift this up so the camera can see, and I'm going to check his Achilles reflex. Good. Good. His patellar. Now I'll be checking for his clonus, and Babinski, and for that I'm going to just slightly move the camera down so you can see his feet. I want you to just relax your feet and let them go back into natural position. So check for clonus. I'll lift and dorsiflex and release bilaterally, and they would have bounced if there was a positive clonus, and they did not, which is good. If you can lift your leg up a bit, I'm going to check for Babinski with the end of my reflex hammer. And although it was a little bit ticklish, you can put that down to the other one. A positive Babinski would have been his toes flaring off to the side, which they did not do, so that is good. We'll move on to cerebellar function. And, oh, I wanted to check his sensation too. I'll go back to that. So, when you feel this rubbing against you, I want you to let me know, okay? Just say yes. So shut your eyes. I'm going to check proximal to distal.
Yes. 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 Yes.
Good. Now you can open your eyes, and we're going to move to some other cerebellar functioning. So I'm going to have you do the same thing as me. I want you to tap your thighs with your hands, and then with the back of your hands. And I want you to do it rapidly like this. If you can do that 7 or 8 times. All right, that's good. So now we're going to be checking some of your gait and pronating. So we'll start by this. Go ahead and stand up for me. And then if you can turn so the camera can see you from the side. Yep. And then put your arms out just right in front of you with palms up. Shut your eyes and hold them there. And we'll count for about 5 seconds. Great. You can go ahead and open your eyes and put your arms down. From here, I'm going to have you, we're going to turn the camera slightly. I'm going to have you walk over to that dresser area and walk back. Walk back. Go ahead and sit down on the stool. And I'm checking his gait and his balance here. Good. Go ahead and stand back up. I want you to walk the same distance, but on your tippy toes. Good. All right, and then you do the same thing, but on your heels. Fantastic. If you'll just stand right in front of the camera, I'm going to have you side step to the left about 2 times. Good. Side step to the right 2 times. Great. Now I want you to hop on your left foot 2 times. Now your right foot 2 times. All right, you can have a seat. And that concludes the end of my neurological assessment.